here today at the Elmhurst Memorial Addison Health Center at 303 West Lake Street. If you recall, about 2 years ago, we were here for the official grand opening, and it was a wonderful event. So we thought we'd take you back today and let you see how it operates. I don't know about everyone, but I know most of my neighborhood got this flyer on their doorknobs. And it kind of drew my attention because it said immediate care close to home in Addison. I want to know what immediate care is, what urgent care is, and that's kind of why we're here today to hear about what it's all about. But first, let's talk to Mark Hoffman. Mark, you were around when they were building this building, when they demolitioned the old building, and here for the opening of this beautiful facility. So tell me a little bit about Elmhurst Hospital and how you got here.
Sure. Thanks, Lucille. Appreciate the opportunity to speak with you today about the Elmhurst Memorial Addison Health Center and the services we provide here. As you well know, Elmhurst is proud to serve the residents of the western suburbs, and we've been serving them since the hospital was founded back in 1926. We've actually been here in Addison with a physical presence for 30 plus years. As you well know, when that older facility outlived its useful life and we took that building down, we built this new facility. We opened in the summer of 2012 and have been going gangbusters ever since.
Well, it really is a beautiful facility with, it doesn't feel like a hospital environment. You have a more comfortable, the typical prairie style that's kind of become the logo of Elmhurst Hospital. So you come in here and you don't feel intimidated. So you're a little more relaxed. Your blood pressure might be a little lower than it would normally be when you walked into a hospital building.
Sure. And that's exactly the point. The prairie style architecture, the plane tree design was really meant to help put patients and family members at ease so that when they come in, they're relaxed, less anxiety, and as they're here for a visit to their physician or for a hospital test, they're a little bit more at ease.
Well, see, now those are some of the things that we're going to talk about. But first I want to talk about the flyer that was on my doorknob that said immediate care. Now, I hear immediate care, urgent care, and I really want to know, are they one and the same? Is there a difference? This is definitely not an emergency room, so we want people to be very clear about it. It's not an emergency room, it's an immediate care, urgent care. Can you tell us about that?
Sure, that's absolutely correct. Immediate care, urgent care, pretty much one and the same. Different healthcare institutions use different terminology in terms of describing the particular service, but immediate care and urgent care are really one and the same, but distinctly different from emergency room services. And Dr. Karl Voss, who's here with us today, can probably give us a better clinical understanding of the difference between the two.
Well, let's go talk to Dr. Voss.
Great, thank you.
Now, Mark, we're here in the kind of the reception area of the immediate care facility, and you're here to introduce?
Yes, I'm here to introduce Dr. Karl Voss. Dr. Karl Voss is the medical director of the emergency department as well as the immediate cares.
So, Dr. Voss, good morning.
Good morning.
And thank you so much for taking the time to join us today. Dr. Voss, you are an ER physician?
Yes, yes.
Tell me what that means.
All the physicians here that staff this location are board certified in emergency medicine. That means they did, specific training in emergency medicine after medical school.
So, immediate care, while I already said it's not an emergency room, it's immediate care is just what it says it is. My child is playing baseball, slides into first base. Now, we're not sure if this is a sprain, a break, a bruise, but he's in pain. Do we bring him in here? Do we run out to the hospital? What do we do?
It depends kind of on the injury. First of all, you don't slide into first base, but
I don't know that. I mean,
that minor injuries, this location and the other immediate care in Lombard are designed for minor injuries. So extremity injuries, if you hurt your leg, hurt your foot, hurt your ankle, your hand, your wrist, those are what we do well here. I mean, we have diagnostic imaging. We can take X-rays. We repair lacerations. We can assess minor sprains, strains, ligament injuries, things like that. It's not an emergency room, so if you're injured badly enough that you're altered, you're confused, you've hit your head, things like that. That's what the emergency department is for. This is more for minor injuries, and I think probably a safe bet is extremity injuries.
So if you're bleeding profusely, there's a bone sticking out, chances are this is not where you want to come. You want to get yourself either to the hospital or call an ambulance, correct?
That's correct. If it's a situation like that, I think 911 is probably your best bet.
But for just those people that I have an earache for quite a few days now. It's not really awful. It's just an earache, but my doctor is too far away, and I'd like to stop someplace on my way to work. Would this be something?
That is perfect. That's exactly what we're here for. Minor illnesses, upper respiratory infections, coughs, earaches, sore throats. That's what we're here for, and it is a great alternative to your doctor because it's quick and convenient.
It is very quick. I mean, while you have, there are people waiting in the lobby, and I see them waiting in the lobby, but you move it right along. It's really very quick, as opposed to sometimes waiting in a doctor's office or an emergency room.
That is true. We have a goal to get everybody seen, registered, and discharged within an hour, and we achieve that goal most of the time.
Honestly, the times that I've been here, it's been way less than an hour. Now, I have some other questions about the immediate care. If it was just a sprain, I understand you can probably wrap it or do whatever. Would they come back here for follow-up?
What we try to do is use this as a location to help our primary care physicians and specialists, feed their practices. So what we often do is we'll see someone and try to arrange follow-up with them with one of the doctors on staff. If it's a broken bone, an orthopedist. If it's a illness, we try to set them up with seeing one of the primary care doctors if they need a physician.
And you do have a number of them right here in this building.
Correct. And that's what we try to do is connect people with doctors upstairs.
Because actually, Mark, we were talking earlier off camera. You have how many physicians in this building?
We have roughly 30 physicians in the building currently. On the second floor is comprised of the Elmhurst Clinic. That's a multi-specialty clinic of over 100 physicians. 21 of those physicians actually practice out of this facility. Of those 21 physicians, 8 different specialties are here in the building. Those specialties include internal med, family med, OB, podiatry, endocrinology, pulmonology, to name a few.
So you have just about everything needed in this building. You also have a dentist that's in this building that is not part of the Elmhurst Clinic group, because actually what you said is this is Old Elmhurst Clinic enhanced.
That is correct. Dr. Marianne Michaels from Addison Dental is on the 3rd floor. We also have another practice, Elmhurst Primary Care Associates, which is a 7-physician internal medicine practice that occupies space on the 3rd floor. All practices are open and accepting patients, and all offer convenient hours morning, afternoon, and evening.
Now, what I like the best is that I have to have regular blood tests, and you don't eat. You have to have a 12-hour fast, and I want something close and convenient. So as soon as you open, I'm sitting here waiting for my blood test. That's the convenient part, but I don't have to go to the hospital for that. I don't have to go to, say my physician is not here in this building. My physician is another building. I can get that order and take that order here, and they will refer the test results to whatever physician I choose?
Absolutely, that's accurate. So as long as you have a physician order, you can come here for testing, laboratory as an example, have testing done here, and that result will be sent to your physician.
Now, it will be sent to my physician, but what if I don't have a primary care physician? Can Elmhurst help me find a primary care physician?
Absolutely. We have a service. It's called CareMatch. CareMatch essentially hooks patients up with a physician based upon a series of questions that are asked via an over-the-phone interview.
So, which is very convenient, because I think doctors need to be convenient to patients, and patients need to be convenient to their doctor, because when you're sick, you don't want to be traveling too far. I, on the other hand, don't like to starve too long, so I want to run right in here, get the blood test, and run over to Dunkin' Donuts or whatever to get that cholesterol up, which I don't need. But so this is very convenient for people. What else can you tell us about? Well, is it either you or Dr. Voss? Tell us about what other testing, what other services can be provided here.
So I can tell you, we offer a full complement of outpatient diagnostic testing. Included within that, digital X-ray, digital mammography, ultrasound. We also have MRI here in the building, and it's my understanding it's the open bore MRI that allows for patients who have issues with being confined in a space, correct, a more comfortable setting to have that done. In addition to that, we have, as we talked about, lab services here as well.
I believe there's physical therapy in the building as well.
Occupational health.
Yeah. Occupational health in this clinic as well. So there's a lot of client companies in the area that use this site for drug screening, for pre-employment physicals, for their injury care. And those are the patients that we do see in follow-up here as well. We, see people through their injury and rehab and whatever's needed to get them back to work.
So you do have occupational health right here in this building, which is
correct. It's
terrific.
part of this clinic. The immediate care also functions as an occupational health clinic as well.
Well, maybe in a few minutes we can take a little, maybe nickel tour of what you have and what the services look like here.
Oh, yeah, that's great.
And now, one of the other questions I have, now I know you are an ER specialist. All the doctors in this immediate care are ER specialists?
That's correct. We're all board certified in emergency medicine.
Which maybe that's why we get through here so quickly, because you look at things in a different way. I think, because I've noticed that with emergency rooms, you just look at, let me take care of this really quick, rather than, and everything is right here for you.
Right. And I think the doctors then at work are able to multitask. They're able to see a good number of people in a short period of time, and that keeps the flow going too, which is important in a site like this.
It's definitely a different breed of doctors. You have to be. You have to be able to multitask and move rapidly.
That's correct. That's correct.
So maybe we can take a little tour of this immediate care. Either Mark or Dr. Voss, which one is going to take us on the tour here?
I could take you through this area.
Okay.
This is one of our typical exam rooms. We have 9 of them in the clinic here. It's small and cozy, but it has the equipment we need. The typical cardiac monitor to monitor vital signs, the ophthalmoscope, the lights we use to examine people, the overhead light for suture repair, laceration repair. This is another treatment room. This is the room we use for eye, ear, nose, and throat issues primarily. It is equipped with a slit lamp. With our occupational medicine clientele, we do see a fair number of eye injuries, people that get foreign bodies, get eye injuries, and this is the equipment we use to examine them.
Now, Dr. Voss, before we leave the immediate care area, I have a question that someone had asked me. If a person has been here before and visited the immediate care facility and is very pleased and really liked one of the docs in this area, can they call and find out when that doctor is going to be here and hopefully visit that particular doctor again?
They certainly can. I mean, that's not a schedule that is kept secret, but there are 20 of us in our group. We staff both the emergency department and another immediate care in Lombard, so the schedule does vary, and it's not the same person here every day.
But they could call ahead and say, is Dr. Voss going to be at the Addison Center today? Because I really would like to see him again.
Yeah, they can do that, but I can also tell you that they'll receive excellent care, whoever is here.
And the records are here.
Right.
So if they came by, the records are actually at the Addison facility, the hospital, or the Lombard facility.
That's correct. That's correct.
That would be great. Well, Dr. Voss, thank you very much for taking your time today. I hope not to have to visit you on an immediate care facility, but it was nice visiting you here on a social level.
Thank you very much.
Thank you. Well, now, Mark, this is a lab room. This is where you would come for your regular blood draws. I believe there are 3 or 4 little lab areas here.
That's correct. There are 3 semi-private rooms and a private room that are available in the lab.
which is really very convenient because I think that's why it moves so quickly, because there are a number of technicians, and really you're in and out of here quickly.
That's correct. That's our absolute goal, to get people in and out as fast as possible.
The last time, seriously, I was here, if I was here 20 minutes, I was here too long. That's how quick it was, and painless, I might say. And then I went to have my donut and all those things I shouldn't have been eating, and that's why I have the blood test. But this is just a typical lab room, right? Okay. Want to go down and take a look at the other diagnostic facilities like radiology and mammography and ultrasound, et cetera?
Absolutely.
Okay. Now, Mark, everything is really done right here. There's equipment in here and everything. What's all this about?
That's correct, Lucille. So we're standing in the processing area of the lab. Essentially, specimens are drawn back in the exam rooms and brought back here and prepared and then sent out to our reference lab for testing.
So they're prepared and go right out to the lab?
That's correct.
Okay, Mark, we're now in the imaging area.
That's correct. So we are in one of our X-ray suites. There is digital imaging performed in here. Those images are then stored electronically and then made available to physicians electronically.
So everything, if it's done here today, a physician can basically pretty much have it the same day.
That's correct. So the images are sent to the physician who reads and interprets them, and then sent on to the physicians who order them.
Wonderful. This is really a very large area. I would say it's very equal to the imaging area of the hospital, maybe even a little bigger.
That's correct. So the size of the room allows for ease of use from the standpoint of moving patients around based upon the different types of images that are taken within the room.
I see. Hence, we need the bigger area.
That's correct. You can see above, if you pan above, the equipment is able to move back and forth on that gantry. That's correct.
So
yes.
it's on a track, and it actually can go back and forth. I see. So they can turn the table around. They can do a lot of things. They can adjust the table. They can adjust the equipment.
That's correct. To make the taking of the pictures as comfortable as possible for the patient.
So once they're relaxed, they can move the equipment around rather than the patient around.
You got it.
Perfect. We're here with Simona in the MRI area. Simona is an X-ray technician here, and she's been gracious enough to just answer a couple of my questions about the MRI. Simona, this is one of the closed MRIs. There are others, but this is a closed one. Now, I'm a patient. What does a patient need to know about an MRI?
Well, the main thing about the MRI is that during the exam, you have to hold still. The technologist is going to ask you quite a few times to hold your breath to prevent the motion. And then depending on the exam, that affects the duration of the MRI.
Depending on how much they want to do.
Exactly, yeah. What organ of the body they want to scan. But other than that, some of the exams are with contrast, some of the exams are without contrast. Another thing with the MRI is that we have to make sure that there's no metal foreign body in your body, like
so if you
history
had
of
knee replacement or something, you'd need
right.
to know
So
that.
the patient has to bring a form from their physician that it's okay to have the MRI, because this is all with magnets and you can have any metal in your body.
I didn't know it was with magnets. It was an MRI. I never asked that.
Yes, that's what it is. MRI stands for magnetic resonance imaging.
I learned something.
Yeah.
Simona, thank you very much.
My
Thank
pleasure.
You. Thank you. Okay, Simona, we're now in the ultrasound area. Ultrasound is used for a lot more than just moms with babies.
Absolutely, yes. Ultrasound can be done for different organs in your body, for your heart, liver, gallbladder. Also, they can scan lower extremities, upper extremities for the blood flow.
I know they've done the thyroid ultrasound.
Right.
So much more can be done through ultrasound today.
Absolutely, yes. And that's a very safe exam to have done.
Well, see, that's what I understand. Now, is this also the same area that they do the DEXA scans in?
No, DEXA is actually done in the mammography department.
Oh, it's in the mammography department. And again, this is a very pleasant, comfortable, large enough room. Believe me, an ultrasound is pretty painless. It doesn't, you don't.
Absolutely, no pain at all.
No pain at all. The only thing is sometimes the gel they put on the area is a little cold.
Sometimes we try to have a warmer for that nowadays. So everything for the patient's comfort.
Very good. Now, we have Chantel here. Chantel is a student with COD. Chantel, you're going to have an associate's degree this coming year?
In radiology.
In radiology. Actually, in 2 weeks, you'll have your associate's
yes.
in radiology. And you're here in training.
Yes.
Well, wonderful. It was nice to meet you here, and I hope you like the facility, and good luck in your profession.
Thank you.
We're now in the mammography DEXA scan area. They're a little backed up today, which is a good thing, Mark, but this is just, again, a very pleasant area. It's very nerve-wracking when people have to come in for testing of any kind. So the more warm and comfortable you make it, the little more relaxed they are coming in for a test. But this is the mammography and DEXA area?
Yes, it is, and you're absolutely correct. Following the plain tree philosophy, we try to make this as close to home as is possible to put the patient and family member at ease prior to their test being done.
Well, this is just a little waiting area for mammography and DEXA. And as I said, the rooms are booked right now and they're a little backed up, which is a good thing. So we just wanted you to see the area itself. So let's get down and talk about the library and what people can do on their own here.
Great.
Okay. Mark, we're in the community room, which is something very unique for a hospital to have a community room. Can anybody use this room?
Yes, Lucille. The room fits about 50 people, classroom or auditorium style, and it is available to the public. The intention of the room actually is to have people who wouldn't necessarily be coming in for a healthcare-related activity come into the building, like what they see, and then when they do have a healthcare need, they'll remember us.
Well, I'll tell you, it's a very beautiful little community room. It's not really little, it's a good medium-sized room. And it's very convenient. Parking is right out the door. There is a separate doorway. They can come in through the main area. The room is available the hours that the building is open, correct?
That's correct, yes. And it's fully equipped with AV equipment as well. So if you have a need for like a PowerPoint presentation or what have you, we have that equipment here available.
Oh, wonderful. Really a very pleasant room. We talk about Plaintree, which is kind of a pleasant feeling. Good health is not only physical, it's mental, it's social, it's a total well-being. And I think that's what Plaintree strives to do. Elmhurst Hospital is a Plaintree environment.
That's correct. We're one of only a few organizations within the country that has Plaintree designation, and it is the treatment and looking at patient and family from a spiritual, a physical, and a mental well-being standpoint.
The whole being. So maybe the next time we come back and visit, we'll have someone tell us a little bit more about Plaintree and what it strives and how it strives to do what it does.
That'd be great.
Okay. Let's go take a look at the library. Well, Mark, the last stop here on the first floor is the library. This is an area that people can come in. They can look for information. You know, everybody runs to the internet for information, but sometimes somebody just wants to sit down and look through information, not on the internet.
That's correct, Lucille. And this particular room we're in, it's called the Health Education Resource Center, is meant for folks who are in the building, whether it be a patient or a family member, who want to do a little bit of research on a particular medical ailment. They can come down here and look through the pamphlets and the literature and see what's available to them.
Well, and I see there's a lot of literature. One that I'm looking at right now is kidney failure, arthritis. So there's information on just about everything they need, and there is also another resource that you have here that they can call someone.
That's correct. So if they don't find what they need here or would like to do a little bit deeper dive into the research, they could ask for one of our health educators to do med search, and then they would provide them with the material.
And then usually the receptionist at the front counter where we came in can give them a number or a contact or someone to reach.
That's correct, yes.
Now, this room is open every day. anyone can come in at any time as long as the building is open and sit down and use the resource center, correct?
Yes, that's correct. So open, the hours that the building is open, and you don't have to be a patient. You can come in and use it if you have a need.
Okay, Mark, we're now on the second floor of the Elmhurst Memorial Addison Health Center. And this is the Elmhurst Clinic area where people come to visit their physicians. This is where you said, how many doctors are up here?
So there's 21 physicians who have offices and office hours out of this facility.
Okay, and you call ahead, you make appointments with your own doctor. These are your own doctors.
Yes, that's correct. So you would make an appointment and then come in and see your physician at that appointment time.
Okay. Unlike the immediate care downstairs that you can walk right in and see an ER doctor.
That's correct. The immediate care is walk-in availability.
Now, the hours of the building, Mark, Monday through Friday, and then are there different hours for Saturday or Sunday?
Sure. So the immediate care is actually open 8 to 8 Monday through Friday and 8 to 6 on the weekends. The other hospital-based departments essentially may have different operating hours, and one would need to check with that department via the website to get that information. And then the physician offices, essentially those hours vary based upon the physician. But they do have convenient morning, afternoon, and evening appointment times.
Well, very good. And we will put the website up and the phone number up. And we thank you very much for joining me today. Maybe sometime in the very near future, we can come in and talk to some of the doctors here at the Elmhurst Clinic.
We'd like that opportunity. Thank you.
Thank you for joining us today, and thank you. We hope you enjoyed your little visit here at the Elmhurst Memorial Addison Health Center. I'm Lucille Zucchero for Addison Community Television.